He's trying to find out how much rock dust costs.
Oh, really? Okay, so Mark's talking to his son on the phone about his farm.
Yeah.
Buying rock dust.
Yeah, well, rock dust is trying to remineralize the soil
because we have depleted soils. It's a big problem. So we spend a lot of time talking about dirt. But today, and we will talk about dirt, not about other people, we'll talk about actual dirt. Unless I can get the Ukrainian president to give me some dirt.
Yeah.
Something.
Oh,
other than that, we'll just create our own, right? So today, Mark and I are going to talk about.
Well, we've taken a lead role in starting a journal called Proceedings of ACIM. ACIM as an organization we just had the meeting with, which we mentioned in the last video, but you don't have to go back to the last video. Don't suffer any more than you have to.
Right. It's a scientific journal. It's peer reviewed, and I will actually put a link to it right down there, and you can actually see the journal.
At the meeting, a lot of
publishing papers.
A lot of clinicians want to get involved in research, and they want to know how. And to us, the best way to get involved in research is start doing things where you can measure your patient's progress. That's step one. Just incorporate some different ways to measure
the best way to walk. The best way to walk 1,000 miles is to take the first step.
Yeah, and so one thing a lot of people ask me about is like, why do we use a brain gauge, or why would you use a brain gauge for anything? I was like, well, let's back it up a minute, and let's say, suppose you've got a patient who weighs, let's say, 450 pounds.
For example. Not that this was the exact weight that I cited in an earlier conversation with Mark off camera.
Just off the top of my head, and just say, okay, your patient comes in, you say, what's the first thing you're going to do as part of their program? Well, the first thing they do, you actually weigh them and see how much they weigh.
How do you know that a weight loss program works?
So then, maybe you put them on a weight loss program and they're losing 2, 3, 4, 5 pounds a week. You're not going to know unless you weigh them, or unless they weigh themselves.
They might say to you, I feel lighter, I feel better, and all of that's really wonderful. It's important, but
let's see, 450. What's let's say 4.5 is what percent? 1% weight loss. You can't look at them and say their clothes are definitely looser.
You'll never see that. Heck, I could lose 10 pounds. You never notice it.
But basically, the way clinicians, for the most part, by and large, are dealing with brain function, and I don't mean to offend anyone who's actually doing measures.
Yes, he does.
But there's a lot of people that just aren't doing any measures. But they just say, I've got this patient, and they feel so much better. They feel so much better. Well, that's great. And so now we're talking about self-perception, so the patient feels better. Well, sometimes those patients have been given opiates. So, they feel better. They're happy, and they come back for more and more and more. But that's not really the answer.
They might be feeling better or worse for a lot of reasons unrelated to their actual weight.
So we're just saying, let's use some quantitative, objective measures to track progress of whatever they're doing.
Yeah,
now, once that's incorporated, go ahead.
Oh, I was just going to say, so Mark and I are taking kind of a lead role here at the ACIM to help people realize that when you take measurements, you can take measurements on a single person, measure things, and then you can report that as a case report, as a clinical case report. These are very common in the medical literature. Physicians do them, surgeons do them all the time.
That is actually how most physicians have learned throughout medical school. They don't learn by group studies. They learn by case after case after case.
That's exactly. You learn from particular cases. And the way we learn a lot about medicine, a lot about disease and recovery and things, case by case by case. It's not necessarily that we only look at, once you've seen a bunch of cases and you see a trend, maybe it's time at that point, you've made the observations, to put these things all together and do a larger meta-analysis, right?
Yeah, just do a review or an opinion or something.
Or it may even be advisable to do a study where you start with the idea that you're going to look at groups and controls and do crossovers and things like that.
Yeah, but that's the difference between prospective and retrospective. And now the problem with prospective studies, where you want to prove that something works, you got to start giving patients placebos and stuff like that, and that's
all these things
not really
they're
ethically
kind of
correct.
Ethically questionable in the minds of many people, even though I'm sure we'll get a lot of negative flack for that. But it all starts with N of 1.
With an N of 1, measuring, and basically that's really helpful. One of the really important things is all the people I've talked to, and I'm sure all the people you talked to, seems like they had something to offer. They have their unique ways, and they see a patient and they take them, and the patient seems like, they've been giving 2% chance to live, and they take that person, and all of a sudden they're successfully treated for whatever they've been treated for. But then what do? They never tell that story. So we're trying to get people to tell their stories and say, what is it that you did that's so unique? And we just want people to tell their own story and make that contribution, because that was the heart and soul of medicine 100 years ago.
Yes, it was. And a lot of the people in this one particular society that we're trying to help, ACIM, they will see patients after they have exhausted all other options, and they've been more or less thrown out of or decided to move on from mainstream medical science, and they're getting these integrative treatments, and the claims, the claims of success are quite frequent and everything. And so Mark and I are, I'm taken aback by this. Okay, this is a person who had, no chance of recovery going to see a mainstream physician, and yet they're doing really well now. Where's that written down? Very often nowhere.
Yeah, and so mainstream medicine relies by and large on group studies. And so how do you do a group study? Well, let's take, first it's called inclusion and exclusion. Who are you going to study? And let's develop a drug for somebody. It's like, okay, now we can't we're not testing white mice, laboratory mice, they're all genetically identical. But to make that study really work, yeah, I am trying to get started.
He's trying to get me all fired up here.
To get that study to work, what do we need to do? It's like, let's not really look at 30-year-old women or 40-year-old men. Well, let's look at 55 to 57-year-old men, and I know I've got them started by now.
You never see a physician who says, accepting new patients, only 57-year-old white, Caucasian, blue-eyed Protestant males. You don't see that. Physicians, caregivers have to take humanity as it comes, and all the diversity that we have. And so, there's a growing number of people who believe this, that the extremely narrow studies that are being done, and some of them don't even involve human subjects, many of them are animals, but extremely narrow, genetically identical animals, to try to find a broad therapy for humans on genetically identical animals, where it doesn't even work if you use a different strain of mouse or rat. That is a disservice to science. That's misusing science. You use genetically identical animals when you're trying to tease out a molecular mechanism or some sort of underlying thing, and then you want to take the diversity out of the equation. You want to just look at the mechanism. That's the right time to use a very narrow range of people or a very narrow range of animals. But if you're trying to find a broadly effective and safe therapy, you want to look at a broad range of people without, regard to gender or age, but using common sense, right?
Yep. So basically, our approach is let's enhance, celebrate the diversity. Use whatever diversity there is, because that's real life. And so we really want to see what people's observations are. And it's case reports. It's not anything fancy. It's just tell us what happened with your patients. And did you successfully treat them?
I'm going to do something that I never do. I'm going to ask Mark for permission. May I discuss what I consider to be our very first success with a graduate student?
Sure.
In mind. Okay, so I had, make these PEMF devices, and Mark and I were helping a nurse through graduate school to get her PhD. And we told her that she was going to run into trouble trying to study these things, prospectively by handing them out. So she had to do them retrospectively, just surveying people who had already decided completely before any study that they were going to try PEMF. And it was an extraordinarily diverse group of people. The ages ranged from 18 to, I think, in the 90s, and all these things. And the university kept trying to really narrow her down. No, you got to look at a really narrow range of people. There's this pathology where they keep saying, they feel like they got to box you into a corner. But she was ultimately, when she was done with the university, she was able to talk to a lot of different people And her findings were, and I may actually publish. I'll put a link to this in this.
It's
we'll
actually online.
It's online. It's on the proceedings, and I'll put a specific link to it. She found 99% of people in this extremely diverse population were getting relief from pain, and 98% of people were getting improvements in activities of daily living, and 80%, 86%, I think, that's somewhere in the 80s, were actually reducing their use of prescription and non-prescription drugs.
Yeah, very useful to know.
In a diverse population, without restriction to gender, age, race, or anything, you start seeing numbers like that. You start to think, okay, this thing really works. On the other hand, if I have a cure for cancer, but it only works for a certain type of mouse, at a certain time of day, what does that mean for human treatment? Maybe nothing.
Not a whole lot.
So, are we still on topic, or did we drift too much?
I think
we're talking about. But it started with, the point is that her study started with one person at a time, and she was looking at individuals, and I think she's going to continue on working and doing essentially case studies.
Right.
She's going to look at one person, and she's going to look at the whole person, the overall person, and the whole. I've made some videos with her. It's Dr. Stacy Revit, who's now a nurse with a lot of alphabet soup after her name, but there's some.
Yeah, she does have a lot of characters.
It's longer than her name, Okay, that always indicates that there might be just a little bit of a problem.
We give her a hard time all the time.
That's okay. Yeah, she's
used to it.
She's getting used to it anyway. But basically, I think one of the things she's going to do is start really, diving deep on this and looking at the whole person and doing individual case studies, because it's very interesting when you start to look at a person. And here's another reason to do a case study. How often do you ever see a person doing precisely one thing to treat a serious condition? I would go out on a limb and I would say approximately never. It's approximately never. It's approximately 0% of the time, because most people are trying a bunch of different things at the same time. So when you're doing your study and you're trying to control for all these things, you exclude them. What you miss is all the synergies. But if you're going to be healthy, it takes synergies, right? You got to be doing the right things. You got to be eating the right foods, and you got to, a lot of things together, right?
Yeah.
So if you don't get that synergy right with the exact single controlled group that you're using, you get it wrong. So how do you determine these synergies? You make a collection of individual case studies.
That's right.
And then you start to look for patterns. You start to say, well, gee whiz, all the people who exercised turned out to be healthier. All the people who ate a lot of processed food started to get sicker at an earlier age. You start to see these kinds of patterns. All the people who were using PEMF, 99% of them were having reductions of pain, and if you can put a number on it, it's even much better. So when we're starting to talk about brain function, and you start to wonder, is a person getting better? What you do is one at a time. In this big, diverse, messy world, you start measuring something really important. You start measuring brain function.
Yeah, and some of the case reports to me are kind of interesting, because the treatments at work are like the last place you look to find your keys.
It's like the car keys problem, right? Where are your car keys? They will always be in the last place you look for them.
And
right?
so then you got to say, well, is it synergistic effects of the first 8 months of treatment? Then you stop and do another treatment that works. Or, that's just all opinion, because it's a case report. It's not a study.
Right.
It's just a case report.
Well, Mark, correct me if I'm wrong here, but I think you've run into a few cases where they're trying all kinds of alternative treatments, and then all of a sudden they do something, and there's an improvement in that person, and they're just like, they stop seeking treatment because they're, better.
They're much better.
They're much better. And so, you need to start looking for these things, and in this case, in this particular case, I'm not saying it always is, but in this particular case, it's PEMF. And a person had tried all kinds of other touchy-feely, alternative treatments. And so one of the things that I think people in alternative world fear is that if you really start looking at some of these things, you'll start to notice that the pattern that people who are doing one particular mode of treatment may not be getting better until they either combine it with some other thing for synergy, or it may just be that it's not helping at all.
Right.
So, we have to be kind of careful about this, because there's some people who don't want to know the truth, and they're on both sides of the fence. They're in the mainstream medical fence, And there are people who don't want to know that it would be possible to eliminate whole classes of surgery and entire states of disease if people were willing to really seriously give consideration to something outside of the mainstream. And that threatens a person's livelihood. But it does this in both sides.
Well, it's also people get locked in. We get to be our age, we don't want to do anything different.
But if you want to know the truth, the way you find the truth is that you start looking at a diverse population, one person at a time.
That's right.
So,
and if you want to read about one funeral at a time, go back to the last video.
Go back to our last video if you want to read about one of the many things that stops this kind of thing. There are people who say, oh, you can't know anything until you do a carefully controlled, study with a lot of statistics. So there's statistics, by the way, very deeply misunderstood.
Imagine if we studied something like the effect of washing hands by case study, case report after case report. You find out, people that washed their hands did not promote infections, and people that did wash their hands.
This was actually
didn't
described by Semmelweis, a German guy, a long time ago, and he started pointing out to these OB/GYN people back in century or more, 2 centuries ago almost, that washing their hands reduced case by case, individual cases reduced the number of infections in pregnant
But every
women.
Case was different.
Every case was different. And
except,
they poo-pooed
except
it.
they washed his hands and there was no infection.
They psychologically beat him to death, actually. They did in his field, just for having the temerity to point out that washing your hands is a good thing for surgeons to do.
Yeah.
And most of them today do it. But it's sort of like if you want to know the truth, you have to look. And it's very safe to be able to say, well, we can get this to work in mice, or we can get this to work with a very narrow range of people. But when you start looking at diverse communities, if you love the truth and you want to know, is there a cure or a treatment that's really effective, looking at a diverse community is the way to go.
Yep.
So I think we
had a really long one the last time. We should probably shorten this one up.
Yeah, this one's nice and short, so you can carry on whatever you're doing.
Yeah,
Carry on.
You can ignore us the rest of the day.
Alrighty.
All right, bye.